conditions. And proceed to the presentation. So I will take you to some of the basic understanding of the various kushta conditions mentioned in Ayurveda. In that, the dosha and lakshana, dosha and related lakshanas, and lakshana and dosha, dhatu, etc. Dhatugatatva of the doshas, the doshas and their implications in the lakshanas, and the principles of panchakarma. Some of the common skin diseases which comes to your clinic and their management through panchakarma, and some of the shamanaushadis, and conclusion. I'm not going to detail into the samprapti or nidana or lakshanas of the various skin conditions, because I assume that in the previous classes already it was dealt by some of the eminent speakers previously. So I'm directly going to the clinical aspects. One of the main problem with the dermatological conditions when it comes in the clinic is many a time we misjudge or misunderstand the condition, and we fail to understand the dosha involved in the particular disease. So based on that, we plan to treat the patient, and it will be utter failure. But when it comes to the skin problems, the diagnosis is not a very big thing, because we should understand the various skin ailments based on the dosha involved. So that is why Lakshananusara dosha vivechana is one of the very important factor when it's come to the skin conditions. So in the Charaka Samhita Chikitsa Sthana, while mentioning the Kushta Chikitsa, Acharya Charaka very beautifully mentions that the lakshanas, based on the lakshanas which is exhibited on the skin, we should understand the dosha involved. And I understand that Rukshata, Shosha, Toda, Shula, Sankocha, Ayama, Parushya, Kharata, Harsha, Shyavarunata, Tukswapa, Tuksankocha, Shofa, Veda, and Kaunya. These are the lakshanas which are related with the Vata predominance. So you can see that there are certain lakshanas which is related with the texture of the skin. Some are related with the perception by the patient. Some are related with the lakshanas or the appearance of the skin based on the color, etc. So Rukshata, what you mean by Rukshata is the skin will be very rough in nature, and Shosha, there will be shrinking like old age skin. The shrinking of the skin will be there. Toda, as Shula is one of the cardinal feature of the Vata, the Toda will also be seen in Vata predominant condition. Sometimes it's also Shula. The difference between Toda and Shula is Toda is very pricking type of pain, while Shula is a generalized pain. Sankocha, the contraction of the skin. Ayama, stretching. Then Parushya, feeling of roughness. Then Kharata, hardness. Then Harsha. Harsha means the patient will feel sometimes horripilations in associated with some skin ailments. Shyavarunata. The Varna is very important factor when it comes for the understanding of skin diseases. Many a time, we misunderstood the dosha based on the color also. Here itself, if it is Aruna Varna is generally we attribute to the Pitta, but when it comes as Shyavaruna Varna, it should be understood as the involvement of the Vata. But when it comes to Pitta, the Aruna will be Raga. The terminology used by Acharya is Raga. Raga means very bright reddish color. Then Tok Swapa, the Suktata of the Tok also will be seen. Tok Sankocha, Shobha, Veda, and Kaunyata. So these are the breaking or the swelling or the hard swellings are seen or the Vata predominant conditions. Based on these lakshanas, we can understand the dosha involved in the skin condition. Then comes to the Pitta predominance. Pitta predominant conditions will exhibit Daha, Raga, Parisrava, Paka, Visragandha, Kleda, Angapatana, Avadharana, Akshiraga, Puti Kleda Bahula, Trishna, Kshiprothana, Satjvara. So these are the lakshanas associated with the Pitta predominance. Daha, obviously, all of you know that there will be burning sensation associated with the Pitta. And Raga, as I mentioned, the lakshana we should clearly distinguish from the Vata environment. Here, the Raga means the bright red color, but in Vata, the color will be Shyavaru, darkish red in color. Parisrava, there will be secretions, but when associated with the, sometimes the srava will be seen in vata predominant conditions also, but they will be very thin in nature. But when it comes to pitta, there will be a slight yellowish in nature. Paka, paka means the putrefaction of the associate the skin lesions. Visragandha, the gandha is one of the main feature which is associated with pitta. Visragandha means like a the mamsa, the smell of the mamsa will be seen. Kleda, kleda is again the secretions. There will be lot of secretions will be coming out of the pitta predominant condition. Angapatana, angapatana. After the skin lesions are produced, the particular area will be putrefied and the organ will be detached from the body. Especially it's very much pointing towards the involvement of the leprosy kind of diseases. Avadharana, Akshiraga, Putikleda Bahula. So Putikleda Bahula, Kleda and Parisrava, all these are somewhat related different stages of the secretions. Then Akshiraga, the redness of the eyes also seen associated with the Pitta. Trishna. Trishna is excessive thirst because of the involvement of the Pitta. Excessive increase in the Pitta, there will be association of the Trishna will also be seen. Kshiprothana, the sudden relapse of the condition, will also seen in the Pitta predominant conditions. Sajjvara, always it will be associated with the jara or the temperature, increase in the body temperature. Then comes the association of kapha. When the skin diseases are involved with the kapha predominance or kapha conditions, the shvetata, the varna is shveta. For vata it is shyavarunata, for pitta it is raga, and for kapha it is shvetata, whitish in color. And shaityata, generally they feel the shitata of the lesions, but in pitta there will be daha. Then kandu. Kandu is itching sensation. So the cardinal features of all the three doshas will be seen in skin diseases. That means in vata there will be shula or toda will be seen because that is a cardinal feature of the vata. And in pitta association, daha will be seen, and in kapha association, kandu will be seen. And stairyata, the stira katina mandalas are seen in the kapha predominant condition. Utseda, elevated one. Gaurava, gaurava, guruda also we can say, or we can say some whitish discoloration also. Sneha will be snigdha in nature, and kledata will be seen. Kleda is also seen in pitta. When compared to the kleda to pitta, when it's compared to kapha, the kapha kleda will be more thick in nature than varna bheda. So in the shweta itself, there will be slight changes in the varna also seen. Lightish discolorations we can observe in the kapha association. Then shofa and srava. These are the cardinal features of the skin conditions, and based on these lakshanas, we have to identify whether it is vata predominant or pitta predominant or kapha predominant or samsarga, the combination of two doshas or combination of three doshas. This is very important because if you try to understand, if you could elicit these lakshanas and understand the involvement of particular dosha, the treatment becomes very easy. So that is why I say we need not be panicked by seeing a skin condition, the severity of the skin condition, but try to understand or identify the lakshanas, one and each and every lakshanas, and identify the dosha involved in that particular condition. Because all the panchakarma procedures which is mentioned in the pushta is based on the dosha only, not based on the diagnosis or the nama or the disease nomenclature. Okay. Coming to the dosha, dushya, and lakshanas, we should further understand up to which dhatu level the doshas are involved. So generally the kandu is seen in kapha and association of rakta, and in pidaka the pitta and rakta and mamsa, and in shavata the blackish or the blackish red in color is associated with vata and tok and rakta. Tok means it is nothing but the rasa. And srava, pitta and kapha dosha involvement will be there associated with the rakta and lasika. And shyama and vata and tok rakta. Shyama is blackish in color. Praklina, the kleda pradhana avastha. In that, kapha and pitta will be seen and associated with the rakta and lasika. Raji, the different discolorations over the skin lesions is mainly because of the vata and involvement of the rakta. Similarly, paka due to pitta and rakta, and brana due to pitta and rakta and mamsa, and ruja especially because of the vata and mamsa. Okay. Again, dhatuka tattva of the kushta, which is mentioned by Acharya Vagbhata and Acharya Sushruta, and if the doshas are involved in tokgata, that means rasadhatu, sparsha hani will be there. Sparsha hani means the loss of sensation over the affected areas. Swedanatva, excessive sweat will be there. Ishat kandu, little itching will be there. And vaivarnya, discoloration will be there. And ruksha bhava, dryness of the area will be seen. So when it, according to Acharya Vagbhata, if the doshas are involved in tokka, then toda will be there, vaivarnya will be there, rukshata will be there. I think these terminologies are familiar. Some of the terminologies are familiar to you, so I am not going to translate it further. In Raktava Tattva, Toksapa, the Suktata of the Tok will be there, Romaharsha and Sweda Pradhanata will be there. And in according to Vagbhadacharya, Sweda, Swapa, Shwayatu, and Shwayatu, Abhipravartana will be there. Then Kandu and Vipuyaka, the Puya Sravata will be also seen. Mamsagadattva, Bahulya, Bahulata of the distribution will be for a very large area. Vaktra Shosha will be there. Karkashata of the skin lesion will be there. Then Pitakas also will be seen. Toda, Spota, and Tiratva. The lesions will be very tirata, deep-rooted in nature. Or we can say, Tuksputana also we can see. The breaking over there will be discontinuity of the skin surface. Then Panipadashita, Spota will be there. Then Sandhi Kledadikatva also seen. Medogata dhatu involvement, Daurgandhya, Upadeha. Upadeha means some kind of feeling of lepata over the body. Then Puyakrimi, the krimis will be produced over the prana. Then Puyakrimi Pradurbhava. Then Gatra Beda, Gatikshaya. Gatra Beda will be there. So Gatra Beda means we can say pain over the various body parts, especially on the joints, and loss of movements. Angadalana. Angadalana, again, the falling of some of the body parts, especially the fingers and Kaunmyata. We can say it is related with the Angadalana only. So Hindu says that Vikala Panitva. So some deformity over the extremity is also seen. Then when it comes to Astigata doshas, Nasabanga, then Akshiraga, Krimiudbhava, Inbrana, Shaya, Shatecha, Krimayaha. So some sort of injuries caused, and after that there will be the production of the skin lesions, and there will be production of the krimis also. And again, Sorobhagata. So this is one of the interesting feature. Sorobhagata is seen associated with the skin diseases. Then we should surely suspect regarding the Astigatatva of the dosha. Okay. Then Shukragatatva, Kaunyata, Gatikshaya, Angabeta, Shata, Sarpana. So these are the lakshanas seen in the Shukragatatva. Okay. And before entering to the Chikitsa Sutra, again, I would like to emphasize some of the lakshanas, which is very much common when comes to your clinic. One of the cardinal feature is Kandu. Kandu is generally, as already mentioned, Kandu is associated with Kapha. Okay, but sometimes what happens is the Kandu may be associated with Pitta also, but it very rarely happens. Again, Kandu may be associated with the Vata also. Okay, so we should clearly examine the patient for understanding the involvement of which dosha is responsible for the Kandu. I will explain. In Vata generally, due to excessive Rukshata, if some kind of, is it audible?
Yeah, sir, audible.
Okay. So, in Vata, generally due to excessive Rukshata or Parushata of the skin, some Bhedana of the skin, the breaking of the skin may happen. Due to this excessive Rukshata, sometimes the patient may feel Kandu. That will be very mild in nature. So, if you apply some of the Siddha Dravyas, that Kandu may reduce. Okay. So, but another Kandu which is related with Pitta is little difficult because even though Kandu is not a cardinal feature of the Pitta, but sometimes what happens is due to the excessive Rukshata, after doing some Ruksha therapies, or excessive increase in the Pitta also, what happens is there will be increase of the Pitta happens, and due to that, there will be Kandu will be produced. Again, for your clarity, I will explain. In the Jwara Chikitsa, Acharya Charaka says that after the continuous Langanadi Krama and Kashayapana, etc., the Rukshata in the body increases. And because of that Rukshata, further there will be increase of the Agni, the Tejo Guna in the body. Due to this Tejo Guna, the Pitta increases. Because of that Pitta, again Rukshata increases. And this is going into a cycle. So that is the lection of the Jirna Jara. Ruksham Tejo Jwarakaram, Tejashta Rukshitasya Cha. So this is the sutra mentioned in Charaka Samhita, in Nidhanasthana and again in Chikitsa Sthana, Jara Chikitsa. So how this increase of Pitta going to produce the Rukshata in the body? So that is why we should understand the nature of Pitta again. Pitta is mentioned that Pittam Sasneha Tikshnoshtam Lagu Visram Saram. Sasneha is the nature of the Pitta. Sasneha means Ishat Sneha. Okay, Ishat Sneha, and Dravaguna is also one of the nature of the Pitta. But again, if you understand the physiology of Tridoshas, in that Acharya Chakrapani says that the Pitta is again of two types. One is Sadrava Pitta and the another is the Nirdrava Pitta. Sadrava Pitta and Nirdrava Pitta. Okay, so Sadrava Pitta and Nirdrava Pitta. The best example for Sadrava Pitta is all the gastric juices are Sadrava in nature, predominantly liquid in nature, and more water content. Nirdrava Pitta, the best example is Gorochana. Gorochana is also Pitta, but it have less Pitta Prabhavas. So when Rukshata increases in the body, the Dravamsha of Pitta slightly going down and it becomes more Ruksha in nature. So when Rukshata increases, that dries up the Pitta and produces Nirdrava Pitta. So when Nirdrava Pitta is there, Tektadravatvam Pakadi Karmana Analasaktam. It is the nature of the Pachaka Pitta in the body. So Pachaka Pitta is Nirdrava in nature, and that further increases, and which is very predominant with Tejo Mahabhuta. So because of that increase in Tejo Mahabhuta, again Dravamsha in the body will be dried up and it causes the Rukshata. Again Rukshata causes the increase of the, reduces the Jalamsha, increases the Nirdrava Pitta and increases the Tejo Mahabhuta. So this is a cycle. So this we can see in Kushta also. So that is why I say when Nirdrava Pitta in the body increases because of the increase in the Pitta or because of the continuous Rukshana, what we have done as a part of our treatment modalities, the Rukshata of the body increases, which produces the Parusha again. Because of that, again, there will be itching sensation over the body will be seen. Practically, we can find this kind of Kandu also, because I will explain in the further classes while explaining some of the clinical experience where this kind of rukshata due to pitta is seen. Okay, so then comes the third one, the Kandu associated with the kapha dosha. Okay, so in such conditions, whenever we do some sort of rukshata in the body, the Kandu also will be reduced. Or kapahara chikitsas are done, the Kandu will be reduced. Even after application of kapahara chikitsa, we have to check for upashaya and anupashaya. Even after the application of kapahara chikitsa in kushta, if Kandu is not reducing, surely we should suspect the involvement of the pitta and vata. Identifying the involvement of vata is more easier than the pitta, because externally we can visualize the changes in the skin. But if that also is not there, surely we should suspect the involvement of the pitta. Okay. Similarly, the varna also. So the redness, we should grade the redness properly. If it is very darkish red in nature, there will be more involvement of vata. Sometimes it will be in between very dark red or blackish red to very bright or fiery red. In between, if it is there, we should grade the involvement of vata to the pitta. Okay, if vata is more involved, it will become more towards the darker side. If vata is less, it will be more towards the pitta side. So like that, we should understand, we should keenly observe the lakshanas, identify the lakshanas, then reversely we should understand the involvement of the dosha involved in that particular condition. Okay, so if you are able to identify these doshas, then the treatment becomes very easy. So if vata is there, apply sneha dravyas. If pitta is there, apply virechana. If kapha is there, apply vamana. So that simple is the management of the skin diseases. Okay. The Chikitsa Sutra, which is mentioned in Charaka Samhita, Acharya Charaka says, Vatottereshu sarpir vamanam, Shleshmottereshu kushteshu, Pittottereshu moksho raktasya, Virechanam chalve. Vamana virechana yogaha, kalpoktaha, kushtinam prayoktabhya, prachanam alpe kushte, mahaticha shastam siravyadam, bahudosha samshodhya kushti, bahusho anurakshatan prana, doshe hyati matra krite, vayur hanyad avalamashu, snehasya पानमिष्टम शुद्धे कोष्ठे प्रवाहिते रति वायुर्हि शुद्ध कोष्ठम पुट्टिनम अबलम विशति शीघ्रम. So this is the Chikitsa Sutra mentioned in Charaka Samhita. Similar, with some slight modification we can find in other Samhitas also. Even the Nikandus also mention somewhat similar Chikitsa Sutras. But Charaka's Chikitsa Sutras was very important, because Acharya says that Vatottereshu sarpir. If vata associated conditions are there, the sarpi should be applied. So that means Shamana Sneha should be utilized in vata predominant condition. Shleshmottereshu kushteshu vamanam. If the kushta is associated with Shleshma, vamana is the main mode of treatment. Pittottereshu moksho raktasya virechanam. If pitta associated conditions are there, then Raktamokshana and Virechana as considered as the Shrestha modalities. Vamana Virechana Yoga, Kalpoktaha, Kushtinam Prayoktaha. The medications for these Vamana and Virechana we should select from the Kalpasthana. So that is the meaning of this shloka. And again, Prachanam Alpe Kushte Mahaticha Shastam Siravira. Because as Kushta is one of the Rakta Pradoshya Vyadi, the Rakta Mokshana also having some importance. So that is why, even though it is Kaya Chikitsa Pradhana text, Acharya Charaka mentions the application of Siraveda and the Prachana, etc. If Alpa Kushta is there, in such conditions, go for the Prachana. Again, Prachanam Pindite Rakti. If the dosha, Rakta Dushti is in Pindi Bhuta Avastha, very thick in nature, in such conditions also we can go for the Prachana. Mahaticha Shastam Siravedanam. So if the doshas are involved in large quantity, or entire body is involved, in such conditions, we have to go for the Siraveda. Not only for Kushta, this is applicable for all the disease conditions when it comes for the Rakta Moksha. The next line is very important, very, very important. Bahudoshaha samshodhyaha kushti. Bahusho anurakshata. Because in Kushta Samprapti, you might have seen that there are Sapta Dushas are there. Dosha, Dushya, and also Lasika, Rudra, etc. Because of this much of involvement of Dushyas or Sapta Dravyas in the Kushta Samprapti, we can consider it as one of the Bahudosha condition. Apart from that, in all the Kushta conditions, there will be the involvement of Tridoshas. There will be the involvement of Tridosha in the production of the Samprapti. But we should classify this Kushta based on the predominant dosha. That is, if Vata predominance is there, it is Vata Pradhana Kushta. Or Pitta predominance, it is Pitta Pradhana Kushta. If Kapha is more, it is Kapha Pradhana Kushta. Or if both doshas are there, then it becomes Samsarga Dosha Kushta. Okay. But generally, the Kushta conditions are Bahudosha Avastha. And especially, the Kleda is one of the Drabya which is involved in the Kushta. So that is why generally we say that Kushta is one of the Kleda Pradhana Vyadhi. So because of that reason itself, the Shodhana holds a very important role in the Kushta Chikitsa. So to remove the Kleda from the body, either Vamana or Virechana should be applied. Either Vamana or Virechana, because they are considered as the absolute Shodhana. So that is why the Shodhana holds a very important role in the management of the Kushta. But at the same time, because of the involvement of the Kleda, the Vasti having the less role in the Kushta. Because in Kleda Pradhana conditions, generally, the Vasti is having less importance. Because Niruha Vasti or the Anuvasana Vasti generally increases the Kleda in the body. Sudden increase of Kleda may happen because of the Niruha Vasti. Even though Niruha is considered Ruksha in nature, but sudden increase of Kleda because of large quantity of Drava Dravya is inserted, because of that sudden increase of Kleda may happen in the Vasti Chikitsa. So that is why Vasti is having less importance or many times contraindicated in Kushta conditions. At the same time, Acharya says that Bahudosha Lakshana. Bahudosha Lakshana is a clear indication for the Shodhana. At the same time, Acharya says that Kushti Bahusho Anurakshatan Prana. We should do the Bahusho Samshodhya Kushti. Bahusho Samshodhya Kushti. Bahusho means we should do the Shodhana in large. At the same time, we should consider the prana of the patient also. We should protect the prana of the patient also. Large means we should not try to achieve the Pravarashuddhi in these Kushta conditions, because as Acharya mentioned, Bahusho Anurakshatan Prana. We should protect the prana of the patient every time when we plan for Shodhana, because the patients, because of the Bahudosha, the patients will be having less bala in nature. So that is why whenever we plan Shodhana, Bahusho Anurakshatan Prana. Bahusho. Acharya Chakravarti says that Bahusho means Bahun Varan. Bahun Varan Stoka Dosha Nirtharanam. So we should do the Shodhana in little by little quantity. That means achieving the Avarashuddhi is sufficient in the Kushta Chikitsa while performing Vamana and Virechana. Avarashuddhi is sufficient. But same time, Bahun Varan, we should conduct the Vamana and Virechana or Shodhana procedure repeatedly, many times. Okay. Same time, we should protect the prana of the patient also. Doshehi Atimatra Krite Vayur Hanyat Avalamasu. Doshehi Atimatra Krite. If you try to remove the doshas in large quantity or try to achieve the Pravarashuddhi in Kushta conditions, Vayur Hanyat Avalamasu. The aggravated Vata will sometimes cause harm to the life of the patient. Snehasya Panamishtam Shuddhe Koshte Pravahite. So after the Shodhana, again we can go for the Samshamana Snehas. Samshamana Snehas. Then after the Raktamokshana and after the Shodhana, we can go for the Shamana Snehapanas at the end to control the Vata. Because Vata, it gets aggravated after the Shodhana and Raktamokshana, may cause harm towards the life of the patient. So to control that, we have to use some of the Sneha Dravyas as Shamana Sneha. Vayurhi Shuddha Koshtam Pushtinam Avalam Ishati Shikram. So in the Shuddha Koshta, the nature of Vata is, as you know, the nature of Vata is whenever there is some avakasha is there, some gap is there, the Vata tend to get filled in that place. Similarly, when Koshta Shuddhi is done, or body is purified with the Vamana and Virechan, or doshas are eliminated out of the body, there will be some avakasha or ashaya will be created. So Vata will get aggravated and occupies that lesions, that avakasha sthanas. So, and that may cause some kind of troubles to the body. So, to prevent that aggravation vata, we should advise the patient to take Sneha Dravyas. Okay, so this is the Chikitsa Sutra mentioned by the Acharya. So, Sarpipana in Vatottara condition, Vamana in Shleshmottara condition, and Raktamokshana and Virecana in Pittottara condition. So, Acharya very wisely uses the terminology. Vatottara, Vataja condition. He doesn't mention that Vataja condition Sarpi. Instead, he mentions that Vatottareshu Sarpi. In Vatottara condition, Sarpi should be given, and in Shleshmottara condition, Vamana. Because there will be the involvement of Tridoshas in the Kushta, but when Vata is predominant in condition, at that point, we have to go for the Sarpi. And if Kapha is predominant, go for Vamana. If Pitta is predominant, go for Raktamokshana and Virecana. And Alpa Kushta, you can go for the Prachana, and Mahati Kushta, we can go for the Siraveda, and with Bahudosha, of course, the different kind of Shodhana should be employed. Similarly, when it comes to Vata Kapha conditions, of course, we have to consider the Kapha Nirharana and Vata Shamana with the Sarpi. If it is Pitta Kapha conditions, go for the Vata Kapha Chikitsa initially, then control the Pitta later. Okay, because when we do the Kapha Harana, of course, there will be the increase of Vata in there. So, in such conditions, consider the Vata also and try to control Vata. Then control the Pitta. Okay. So, this is the Chikitsa Sutra mentioned by Acharya. But in some other samhitas, you may be familiar with another shloka. Pakshe Pakshe Vamanam, Masi Masi Virechanam, Shanmase Moksho Raktasya, Virechan Nasyam Sapta Dinantaram, Sapta Dinantaram. Like that, some another shlokas also you might have seen. Based on this Acharya Charaka's version only, they are formulated because Bahudosha Samshodhya Pushti Bahusho Anurakshatan Prana. So this is the sutra responsible for the production of the other shlokas, Pakshe Pakshe Vamanam. Otherwise, Pakshe Pakshe Vamanam is not possible at all. Practically, it's not possible to do Pakshe Pakshe Vamanam or Masi Masi Virechanam. Every 15 days, it's not possible, practically possible to implement Vamana, or every month it is difficult to implement Virechan because Snehapana, then Vishramakala, then Vamana. It becomes almost 10-12 days. Again, on the 15th day, it's not possible to perform the Vamana. But the inner meaning of that particular shloka is Bahusho Anurakshatan Pranan, Bahun Varan, Soka Soka Dosha. Because of the involvement of the Bahudosha, we should repeatedly perform the Shodhana procedures. So that is the meaning of that particular shloka. Okay? I think this part is clear. What is the importance of the Shodhana Chikitsa? And again, coming to the Sneha part. In our clinical practice, you might have seen that many patients come with various skin conditions, and the doctors suggest that take this Grita or that Grita, etc. For example, the first Grita comes to your mind is Tikta Grita or Gugulu Tikta Grita or Aragata Mahatikta Grita. Like that, Gritas will come to your mind generally. Whenever you see a Kushta conditions. As I mentioned, all the Kushtas are involved with the doshas and predominant with Kleda. So whenever you try to impart the Snigdhata in Kushta patients, you should be very cautious. Otherwise, it will end up in some kind of complications. You might have seen that after taking the medicines, the skin condition increased, and the doctors say that അതൊക്കെ പുറത്തു വന്നതാണ്. Is there any other than Malayalis are there in this group? Can I use some Malayalam words in this?
Yeah, sir. 50% is non-Malayalis.
Okay, fine. Then I will stick on to English. So generally, after taking the medications, the Vaidyas say that if the condition aggravates or increases, the doctors say that the doshas are coming out. That is why it increases. After it comes out and goes, that will slowly subside. But it's a wrong practice, because it's a failure of the Vaidya if the medicine increases the particular conditions. If you clearly understand and diagnose the condition and identify the doshas and implement the treatment modality, never there will be increase of the condition during the treatment. So that is why I say, whenever you try to impart the Snigdhata, imparting or application of Snigdhata is very important and should be done with cautious. Generally, because of the Kleda environment, all the Kushta conditions should be started with the Ruksha therapy. It may be internal Rukshata or maybe with the external Rukshana. If you do the thorough Rukshana in a Kushta patient and try to start the Sneha Dravyas, whether it may be Shamana Sneha or Shodhananga Sneha Pana, there will not be increase of the conditions. Okay, so never think Sneha as a first line of treatment for the Kushta, even for the Vataja Kushta, because if it is, if you misjudged it as a Vata predominant condition, and if you apply Sneha in that condition, surely that will increase, that will aggravate, and that will be failure. Okay, so that is why in every Kushta patient, first we should think of the Rukshana because of the involvement of the Kleda. Okay, so it may be mild Rukshata or severe Rukshana therapies. If it is Vata association, Rukshana may be sufficient for 1 or 2 days, and after that you can go to therapies. If it is more Kleda is there, then Rukshata may be more. Abhyantara and Bahya, both kind of Rukshata should be implemented. Okay, again, how much Snehana should be imparted in Kushta Chikitsa? Kushta is because of its involvement of all the doshas and involvement of Kleda and Lasika. Acharya says that Nati Snigdhan Vishodi. There is a group of patients like Kushta, Prameha, etc. In that, Ati Snigdhata is not required for before Shodhana therapy. Nati Snigdhan Vishodi. So Nati Snigdhata means Ati Snigdhata should not be there. So that means that while doing the Snehapana in Kushta patients, we need not to achieve the Pravara Snigdhata. Instead, we should achieve Avara Snigdhata or Madhyama Snigdhata, may be sufficient for performing the Shodhana in Kushta patients. Okay, so these things should be kept in your mind before you enter for any kind of Shodhana therapies for the panchakarma therapies in Kushtas. Okay, and again for the Snehapana, you can use the Kalyana Krita, Panchakapya Krita, Tikta Krita, Ugulu Tikta Krita, then Aragadadi Krita, Padavaladi Krita. There are many Indukanda Krita. There are many Kushtagana Kritas are available. You can choose according to the condition. Okay. Generally, Mahagritas like Mahatiktaka, Mahapanchakapya, Mahakalyanaka are not advisable as to be selected for the Shodhananga Snehapana, because when they are named as Mahagritas, in my opinion, they have more Rasayana and Shamana action in it. So that is why after Shodhana, if you want to give, you can go for the Araguda Mahatiktaka or Mahatiktaka or Mahakalyanaka or Mahapanchakapya, etc. for the Shamana purpose or for the Rasayana action. Okay. So, and For Shodhana, when it comes for Shodhana yoga, there are various kinds of Shodhana yogas are mentioned in the Kalpasthana. Any one of the Shodhana yogas you can select. Generally, for Kushta, when we perform Vamana, Madanaphaladi yoga is indicated. As a Anupana for the Madanaphala yoga, you can use Nimbus Surasa or Kanchanara Surasa, 20 ml you can give before the performance of the Vamana. And for Virechana, a large number of yogas are mentioned in the text itself, like Manibhadraguda Prayoga, then Abhyadivati, then Ichabedi Rasa, then Avipatti Churna. Okay, there are many Trivrit Churna as such with the Draksha Rasa, etc. It can be given. There are many Virechana yogas are available when it comes for the Virechana. Okay. So this is about the Shodhana. Now we will move on to the